So in today's video, I'm going to be sharing with you the step-by-step process of how you can relocate into the UK as a healthcare assistant or a senior carer via the health and care visa route, even if you do not have any health background. Like, you don't have a health background. Yes, it's possible and you can. I've got a lot of people asking me about this visa route, how to go about it and all that, but I wanted to get my facts right. And at the moment, I've got some people coming into the UK like anytime soon. They've already gotten their certificate of sponsorship. That is the COS. And they are coming into the UK as healthcare assistants, even though they did not study anything relating to nursing or relating to health. So if it's something that you are interested in, please keep watching. Please don't forget to like this video, leave me a comment below, and share this video with your friend. I'm sure there's somebody in your circle that is interested in relocating into the United Kingdom as a healthcare assistant. And as a bonus, I've put together a checklist that will help you and serves as a guide to you in this journey to coming into the UK as a healthcare assistant. So just go through the link in the description box below. It will be the very first link that you will see in my description box just down there. Click on the link and you'll be able to download this checklist, and you can just tick off the things on the checklist as you get them done. So basically in this video, I'm going to be talking about the requirements for being a healthcare assistant here in the United Kingdom, the cost implication, the agencies that you need to be talking to, the agencies that I have seen doing this and they have results. Do you even need an English exam? Do you need to have your IELTS? What's the cutoff? What's the band? What band should you be aiming for? All of these and many more I'm going to be talking about in this video. So sit tight, grab your jotter and your pen, and keep watching. If you are new here, hello, my name is Victoria and I am a nurse, I am a blogger, and I'm a Nigerian currently residing in the United Kingdom. On this channel, I share my Nigerian lifestyle here in the United Kingdom, and I love to give useful information just like this, so please make sure to stick around. So if you are watching this, I want to assume that you know what a healthcare assistant does, but if you don't, I'm going to give you a quick overview. So healthcare assistants work as part of the nursing team, and they work to give care and support to people, usually in the care homes. They work in the NHS also, but I haven't really seen COS being generated from the NHS. I haven't. I don't say that it's not possible or it hasn't been going on, but I have not. Most of the COS that I've been seeing are from care homes or support homes or agencies that recruit support worker. So basically what you'll be doing is giving support and care to people, especially people who are vulnerable, the elderly, children, giving care and support to them as part of the nursing team. So basically that is what a healthcare assistant or a senior carer does. If you want to learn more about that, you can check on Google and be able to get more information about that. So what are the requirements? Basically, you need to be educated. The minimum education requirement that I have seen is that you must have a senior school leaving certificate. That is, you must have passed through secondary school. Basically, there are some agencies that say, oh, they only accept graduates, they only want graduates, and there are some agencies that you don't really need to have a higher education, just be educated, like minimum education, SSCE, and you are good to go. Of course, you need to have a passport. You need to have your Nigerian passport, or whatever country that you are in, you need your passport. I mean, your nationality passport. Is that even correct? But you need your passport, sure. Another major thing that you need is work placement requirements. So you are coming into the UK to work as a healthcare assistant, as a senior carer. You need to have experience of what you are coming in to do. So if you are already in the healthcare system, probably you trained as an auxiliary nurse, or you are an healthcare assistant already in a hospital in your country, you already have your work placement experience. So that experience is what they need. Now let's say that you do not have any of that. What you need to do is to attach yourself to a hospital. Go to a hospital to meet them and say, oh, you want to train as a healthcare assistant or as a carer. Is there another name we call it in Nigeria? I'm not sure there is another name that we call it in Nigeria or in other African countries, but I think it's still that healthcare assistant. Yeah, so just let them know that you want to train as an healthcare assistant. Of course, many of them will ask you to pay to be trained, which you should be ready to do. So train as an healthcare assistant, because this experience is important and you'll be needing a reference from that hospital to say that yes, you have trained and worked as a healthcare assistant for so number of months in their hospital. And usually I think the current requirement is that you have at least 300 hours as a healthcare assistant in your home country. If it is different, I'm going to put it on the screen. So you need to have at least 300 hours as a healthcare assistant. By the time you get this training, or by the time you start this training, and you'll be able to have an idea, even though it's not everything you'll be doing in the UK and Nigeria health system or other countries' health system is kind of different in some ways, but at least you have an idea. And if you cannot cope with, you know, being an healthcare assistant in your country, there's no way you'll be able to cope in the UK. So I think that is a good way for you to actually assess yourself and know whether or not to be able, you know, to do this kind of job. Another thing that you need, and it's important, is IELTS. That's your English exam. Like I said earlier, see, some of these requirements, they are agency based. I don't know why, honestly, because I believe everybody is coming to this same UK. You're coming to do the same work, and still one agency will say this and another agency will say this. I don't understand. But really, there are some agents, you know, like I said earlier, that there are some agencies that only accept graduates. They just say they want graduates. Now, for those kind of agencies, I've noticed that they don't request for IELTS. They don't ask you for English exam. But for agencies that accept the minimum educational requirements, such as SSCE, they require you to have your IELTS. So for the IELTS, the minimum band that you should be aiming for is 4.5. That's the minimum band of IELTS that you need to have. Another thing that some of these agencies require of you is your driving license. They expect you to be able to drive, because most of the times when you get to the UK, you'll be working from home to home. You'll be giving support and care to people in their homes, and usually you move from one home to another. They expect you to have a driving license, or at least have an international driving permit, which will help you to be able to drive in the UK, at least for the first year when you get into the UK. So this will make it easy for you to move from one home to another home. But this, I don't think this is a deal breaker, but if you can, it is something that you should aim to have. Another thing that you will need is police clearance. It is similar to what we call DBS here in the UK. So it's like I said, you'll be working with vulnerable adults. So they want to know that you are not a criminal, that you do not have offenses to your name in your country or any other country that you have. So you need a police clearance, and you will also need a tuberculosis test clearance, because you'll be coming into the UK to work for more than 6 months, and the law is if you are staying more than 6 months in the UK at any point in time, you've got to do the TB test, you know, to be sure that you don't have tuberculosis. And another thing that you need to get together is your CV, your curriculum vitae. Put your CVs together. I shared a video of a friend who showed how to do a CV recently on this channel, though it was a nursing CV, but you can actually use that also as your CV template when making this application. So in all, these are like the major requirements that is expected, that is required of you if you want to work as a senior carer or as a healthcare assistant in the United Kingdom. And like I said, different agencies with different requirements, but basically that's like the baseline of the requirements that they request from you. So in the description box below also, I'm going to be linking some of these agencies, so make sure to check them out. And by the time you contact them, of course, they will give you their own specific requirements, which will most likely not be so different from what I have already talked about in this video. Now to the costs. Let's talk money. Getting your certificate of sponsorship to come into the UK to work as a senior carer or a healthcare assistant comes with a cost, and you are going to spend money. Yes, you are going to spend money. Let's start from the agencies. The agencies, they will collect their own money. They will collect like their fee, their agency fees for trying to help you, because they are like middlemen between you looking for a job and employers looking for employees. So they are middlemen. They are going to collect money from you. And from what I have seen so far, the average that agencies collect is around £2,000. It doesn't mean that you are going to pay this at once, boom. Most of them actually give you an option to spread the cost across 3 months, 6 months, as the case may be. Just have it at the back of your mind that agency fee is, on the average, is going to be around £2,000, and you can spread it across several months. Now, apart from agency fee, you need to put into consideration the costs of the training that you get in your own country. That is in the country that you will be in. I mean, in your particular country where you'll be training as a healthcare assistant. You need to put that into consideration. They are also going to charge you. They are going to bill you that you are coming to train as a healthcare assistant. You need to factor that in. Also, if you'll be writing the IELTS exam, you'll be writing the IELTS UKVI. And at the present, I think it costs around 80,000 naira. It might be different if you are not a Nigerian. So you need to actually factor that also in. Getting your passport, your driver's license is going to cost you money also. Getting your TB test done is also going to cost you money. I think the TB test right now is around 60,000 naira. It's going to cost you money also. Getting your police clearance also might cost you money. Getting your police certificate that you are not a criminal, you are of good behavior, might also cost you money. So all these costs actually add up. And like I said, you are not required to actually put everything down. Bam. Bam. By the time you start your process with any agency you choose to work with, you'll be going, they will also help you, they will support you, go through it with you, go through the steps with you all through the way. So it's not like you are putting everything down together. But to get started, you need to have this idea that you are going to have something around £3,000. I mean, you are going to be spending around £3,000 for this. And by the time you get your certificate of sponsorship, most of the employers don't pay for your flight ticket. They might pay for your visa, they might pay for your COS, which is certificate of sponsorship, but most of them will not pay for your flight, and some will not pay for your accommodation when you get to the UK. Some might pay for your accommodation for the first 1 month, while some may not. So there's a lot of money involved. Just have that at the back of your mind. I will estimate with the visa and everything, I will estimate how much you're going to spend to around £4,000. Yeah, to around £4,000. So have that at the back of your mind. It might not be up to that, and it might be more than that. So this is just on the average, as someone who has worked with people who have already gone through this process. So now that you know the requirements, the cost, and the things that you need to do to get yourself a job in the United Kingdom as a healthcare assistant, what exactly is the time frame? How much time are we talking about from the time when you decide that you want to come to the UK as a healthcare assistant to the time when you get yourself down here? The time frame is around 6 months, depending on whether or not you have that healthcare experience already. So if you have the healthcare experience already, it will even be shorter. So the purpose for which I have made this video is to get you going. So if you have the intention of getting into the UK, as a healthcare assistant or a senior carer, you already know the requirements now. You already know what is expected of you now. So start planning. Start planning. By starting planning, I mean, if you are not in the healthcare system yet, you need to get yourself attached to a hospital and start learning the ropes of being a healthcare assistant. At least that one will be out of the way, so that by the time you are ready and you are contacting agencies, you're ready, you are approaching them prepared. You are approaching them with your certificate, with this, with that you are ready to go ahead and to go on. I hope I've really covered everything that needs to be covered in this video. I'll appreciate if you can share this video with somebody, please. And don't forget to like this video, please. Please kindly like this video. It really helps a video to do well on YouTube. Thank you so much, guys, for watching. I really hope you found this helpful. If you have any question at all, please make sure to leave it in the comments section. Thank you so much, guys, for watching, and I'll see you in my next one. Bye.